Welcome to America This Week. United we stand. I'm Eric Bolling. A bright light of hope in the end of a dark 2020. The rollout of Pfizer's coronavirus vaccine is underway right now in hospitals nationwide, and the FDA is expected to approve a second vaccine in the coming days. Joining me now is the coronavirus testing czar for the Trump administration and Assistant Secretary for the Department of Health and Human Services, Admiral Brett Giroir. Admiral, thank you very much for joining us. Important man on an important day, sir. Bring us up to speed on what's going on with the vaccine and the FDA approvals.
Well, this has been a truly great week. As you know, the Pfizer vaccine, which was shown to be about 94-95% effective, is already getting in people's arms right now. 2.9 million doses have been shipped all around the country. And as you said, this week we are expecting that the Moderna vaccine, which is a very similar technology to the Pfizer vaccine, we're expecting it will get authorized and be in people's arms as early as next week as well. Moderna, again, the preliminary data that's being reviewed, about 95% effective, 100% effective in preventing severe disease. And like the Pfizer vaccine, it works across all age groups. And that was a real concern for us because some vaccines work well in the young and healthy, but not in the elderly. Both of these work very well in the elderly, whom we know suffer the worst burden of COVID. So just great news all around. And by the end of December, we believe we'll have 20 million Americans immunized by the end of this month. So great news, historic, and a great win for the American people.
That's fantastic. Great. Congratulations, Admiral. Also, I was reading and watching some of your commentary recently, and it looks like there's some approved home testing potential coming forward. Can you tell us about that?
So this is sort of the next wave of our testing strategy, and we've been working on these since March and investing money, time, technology, leaving no stone unturned. But this week, what you saw was the first authorization of an over-the-counter test. What that means is you don't need a prescription. It will be available online or at your local pharmacies that you buy, you go home and you do the test. It's just sort of like the pregnancy test everyone talked about. This is the first one. There are only going to be about 3 million made in January, but that's a start. And also this week, what you saw authorized is that another home test, the Binax test, which we've sent almost 90 million out, there's a version of that test that is authorized for complete home use as well. Now, that one you need a prescription for, you need a doctor's order, but it's still going to be an at-home test that you can find out right there on the spot within 15 minutes. So this is really the next wave of advances in testing. We've gone from just being in the laboratory to some sophisticated point-of-care tests that were not very scalable to the 150 million card-based tests that you can get, in schools, at retailers, in the nursing homes, now to the home-based testing. So that's where we're going. So another great breakthrough moving forward.
Fantastic. Admiral, tell us, this test, first of all, how long does it take to get your results back, number one? And number two, does it distinguish between you have COVID right now and you had COVID and therefore maybe antibodies?
So both of these home tests, as well as a home test that was also authorized a few weeks ago, but a very small number that are available, they are all rapid. So you get the results within 15 or 20 minutes. And these are tests that tell you if you are currently infected. These are not antibody tests. So these would be tests that say, look, you're infected. Even if you feel well, you're infected and you need to isolate yourself because you could pass this on to other people. So this is exactly the kind of test we want to help inform people, many people before they go to work or before they go to travel, or with the new CDC recommendations, if you can, get a test 4 or 5 days after you travel because you are at higher risk. These things are exactly perfect for that. They're not free, right? They're in the $20 to $30 price range, but that's still highly affordable for most people. And we do expect that the federal government will be purchasing some of these tests that we can distribute to underserved communities to make sure that everyone has equal access.
Admiral, can you clear something up for us? There was a doctor on cable this week who said even after you're vaccinated, that doesn't mean you can take your mask off or you're out of the woods. The question is, a lot of people like me are questioning, well, isn't that what that's supposed to be about? Let us get back to normal life at some point. by getting vaccinated? Are we still going to have to restrict travel, lock down, and wear masks after being vaccinated?
So I think everyone is just being extremely careful until we have the data. Having a vaccine that's this effective should mean that you're not going to transmit the virus. We now have some data, particularly from Moderna, that suggest that you won't transmit the virus, but we just need to prove that, right? Because it is theoretically possible that you could still carry some of the virus and transmit it in a small percentage of people. But I would sort of bring the temperature down of the public right now on this, because I think the physicians, the scientists are just having an abundance of caution that we need to make sure that that's true before we advise it. But let me just say, under any circumstances, by May or June, when 70 or 80% of Americans get the vaccine, the virus will essentially be gone. So whether that's an issue or not, we're going to get back to pretty normal by that time. But I do expect the data will show that getting the vaccine will greatly reduce your chances of ever transmitting it to anyone. But I think we just need to wait to make sure the data prove that. And they won't be too long. We're already getting that suggestive data in, particularly from Moderna, and I think Pfizer will be coming out with that pretty soon as well.
Admiral Brett Giroir, thank you very much for your time.
So happy to be here.